So, the one thing that is clear to me about caregiving and dementia is it is very challenging, very difficult to do it alone. So, what can we tell people who might find themselves in that very situation?
I won't say that you can't do it by yourself, but you shouldn't do it by yourself. Who else do you have? Maybe you don't have family. So, in that aspect, you are doing it alone. But do you have friends? Do you have a support group? Is there a therapist or a psychiatrist involved? The primary care team that supports the person that you're caring for, can you pull them in and sort of feel like they are a part of the team?
I think, but you let me know if you agree, there's still some stigma associated with the diagnosis of dementia.
I am reminded of a client who told me, I did everything right. You know, I ate right, I exercised, I kept my stress down, and I still have this diagnosis of dementia. And so I'm reminded of her often when I think about, yeah, we can do everything right and still end up with this diagnosis, but how do I support you in the right now? I do think there are lots of different drugs coming on the market, and a lot of research is going into the space of figuring out when we're going to cure the first person living with dementia, and I am hopeful for that. But until then, how do we still support the people that are currently living with this diagnosis and the families, friends, neighbors that are helping to support them?
I will tell you that my bias, and I believe in a healthcare team. And so, even just on the medical provider side, certainly I believe in a caregiving team on that side, and I believe in a healthcare team. Are there some healthcare professionals that are typical or that you would advise getting connected to or getting an opinion from?
I think that's a great question. And I think part of the problem is we have healthcare teams, but I'm not sure everybody knows what each member of the healthcare team does well, right? So we all have our expertise. And when we think about dementia, typically you're probably sharing that first with your PCP or your primary care provider. And so a lot of times they'll refer this person to a neurologist, where the neurologist has a team that will do what we call a battery of tests. So lots of different questionnaires, quizzes, to sort of get an idea of what is going on with their cognition, what is going on with your brain, what's going on with your thinking, your memory, your ability to follow tasks, naming different things. A lot of different things that go into a true neurology workup for a diagnosis of dementia. Oftentimes, the neurologist gives that diagnosis. They then refer you back to the primary care provider. There are some neurologists that still see patients, but typically you go back to the primary care provider, where the primary care provider and their team, thank you for highlighting, can do the work. As someone who works as a nurse practitioner, as a provider, I have no idea where the resources are. I can help you manage the medications. I'll give you a little bit of therapy. We can work through some different things and some challenges. But when it comes to knowing where the community resources are, that's where social workers shine. And so making sure that if you are supporting someone with a diagnosis of dementia, that you have a primary care team that has social workers. Nurses are often really, really helpful because they are able to sort of what we call triage or check in to see how difficult what's going on with you. So then they know, do they reach out to the doctor? Do they not? Having someone that's really good at mental health, be it a psychiatrist, psychiatric mental health nurse practitioner, a therapist in the early years is really helpful, because people newly diagnosed with this will struggle oftentimes. They may have never had any issues with their mental health, but to get a diagnosis of dementia when we know we do not have a cure, that can exacerbate a lot of depressive symptoms and anxiety. Another important member of the care team, when we think about advanced dementia, is hospice and palliative care. And I know we probably should rename them something else, right? Because some people are hesitant to think about using hospice and palliative care. But when I think about my loved ones, my family members, I would want to make sure that they have the opportunity to be treated by palliative care and hospice if they need it. Being able to die where you want to die, often at home, in the comfort of your home, with dignity and grace, is something that hospice and palliative care do really, really well. And I would just encourage those who are on this journey, as they're traveling through the dementia disease trajectory, to consider hospice and palliative care. I guess I should say palliative care and hospice, because it typically comes palliative care and then hospice.